Hello, my name is Jenny, and this is going to be my presentation on the Pdsa. I decided to do it on bedside shift report. This is for nurse 451. Issue identification. Change of shift report is occurring at the nurse's station instead of the bedside, although bedside report is encouraged but not required. This leads to missed data, errors, patient safety, patient-centered care, relationships, and communication. Missed data as to errors in medication, vent setting errors, IV infusion pump errors. Sometimes it can also mean missed pressure ulcers, missed wounds that have occurred. Patient safety. This can mean not having the bedside rails up of the bed, so increasing fall risk, and patient-centered care that would lead to the patient not being involved in their own care, not being able to know what's going on. And then relationships. This puts at risk relationships between the patient with the nurse as well as nurse to nurse, because it can cause different point of views, and if misinformation is happening during report, then that would make you feel a certain type of way towards a different nurse. And communication, it's not building communication between the patient, the nurse, the patient and the family, and then the patient itself knowing what's going on with their care. When the nurses in my unit were interviewed, they made excuses as to why they decide to do the shift report at the nurse's station instead of the bedside, and they said there's not enough time, it's an extra duty, they're used to the old habits. Some nurses have been there for years, and it has never been enforced for them to complete bedside report, therefore they just stick to their old habits. They think it's time consuming, so it can cause overtime, which means you're going to get in trouble. Some do not want to engage with the families. They don't want to answer questions. They rather just give the report and leave. Quality variance. Some expectations that would be the norm would be accountability. Being accountable for your actions, being accountable for the patient you're going to be receiving and handing off. You want to make sure the patient is being handed off well. Decreased medication errors. Bedside report would decrease medication errors. You can check the pumps. You can check, review the medications, make sure everything's how it's supposed to be. Increase patient satisfaction. It would be expected for HCAP scores to go up. It would be expected for patients to be more satisfied with their care because they are being part of their care. They're being involved rather than just, being in their bed while they're not being updated or they don't know what's going on. Also, patient and family-centered care, like I said, being involved with the family as well, establishing goals from the beginning. And better communication. Communication is always important because that is what causes the relationship between the nurse and the patient to go well or to go bad, and also between the nurse to nurse, staff. Unfortunately, the results are, because bedside report is not happening, there is medication errors. There's an IV infusion pump errors. There's, people maybe getting the wrong medication, and we don't know these things because we won't see it right at the beginning of the shift, not until after we do our assessment. Another big one is vent setting errors. Vent setting, they're something easy to go and check on the vent, but if we're doing the change of shift report at the bedside, it gets a little bit harder. And then, once again, you're missing, these little errors that can long-term, affect a patient in a different way. Also, decrease patient satisfaction. Patients are not being updated. They're not being introduced to their new nurse that's going to be oncoming. And then patient safety. The bedside rail can be down. They can have an IV infiltrated, and we won't know these things because we are not at the bedside in the beginning of the shift when we're supposed to be. Pros and cons to bedside shift report. Some pros would be patient involvement, satisfaction, adherence, and quicker recovery. There have been studies that show that patients who are involved in their care tend to recover quicker, and they also adhere to their treatment better because they know what's going on. It is also time efficient, although some nurses think, oh, it's going to take too much time, we're going to go overtime. Studies have proven to show that it is time efficient, therefore also can be cost efficient because you're not going to be going overtime. Also, it improves accountability for the nurses, the oncoming nurse as well as the outgoing nurse. You are able to prioritize like the needs of your patients if you're being accountable. Also decrease in errors. You're able to check the vent, you're able to check the medications, you're able to check are the bedside levels up, and also prioritization of care and patients' needs. As opposed to giving report at the nursing station. If you're at the nursing station, you don't know what your patient looks like, you don't know what's going on. If you're at the bedside, you at least have an idea, okay, this patient is going to need my attention more as opposed to this patient. Some cons, nurse resistance, like I said, some nurses have been there for a very long time. It's never been enforced for bedside shift report. It can be a problem for nurses to adapt to something new. Confidentialities, sometimes patients don't know their diagnosis, sometimes the family doesn't want them to know, and that can be a problem as well. And it would be maybe a higher cost for training to train these nurses, to give them education classes on why bedside shift report has its advantages and why it's proven that it's better than giving report at the nurses station. Here are some examples of some errors. As you can see here, a feeding tube was connected to a central line. Here's an IV infiltration, and then just vent setting changes. These are easily easily missed errors that happens because we're not giving bedside shift report, and it can just be prevented if we were to do bedside shift report. So the solution would be progress to bedside report in order to maintain effective communication to reduce errors, increase patient satisfaction, and patient safety. So this would be giving bedside report is the first. While giving bedside report, maybe there could be an implementation on skin assessments, checking the skins, making sure you're not missing wound pressure injuries, making sure there's not new skin tear that you missed, reviewing the medication the patient's on, reviewing the IV pump settings, making sure all the settings are correct, reviewing the vent settings, making sure the vent settings are correct. Fall prevention, like I said, make sure the bedside rails are up. And outside environment, does the patient have a call light within them? Is there stuff on the floor? Is the environment safe for the patient? There have been a lot of studies on bedside shift report and the advantages it has. One study by Ferris says bedside shift report, an alternative to traditional report, has been shown to improve patient-nurse communication, leading to increased patient safety and satisfaction. Another one by Kearns says utilization of bedside shift report has been shown to be effective at improving nurse-patient communication, patient satisfaction, and comfort. And according to the Institute of Medicine's report, to err is human, building a safer health system, between 44,000 and 98,000 people die in the U.S. hospitals each year because of preventable healthcare errors. This can mean, like I said, vent settings, IV infusions. These are errors that can be prevented if bedside shift report is getting done. To implement this, educating the staff, giving them, classes and educating the staff of the studies that have been made that show bedside shift report and its advantages, how it benefits the patient, benefits the nurse, and benefits the whole hospital as a whole. Training the staff, showing them this is how you do it, this is what we should be doing. And, maybe creating a checklist while giving a report, that way nothing is missed. This checklist can consist of reviewing the medications, checking the vent settings, checking the skin, and so forth. Random audits, making sure nothing is being missed during these bedside shift reports. And also monitoring errors. Are there decreased medication errors? Are there more medication errors? And monitoring HCAP scores, which would show if it's affecting our patient satisfaction level in any way. As to analysis, how would we analyze if this is working? We would get feedback from the nurses, families, and the patients. Ask them, is this working? Do you think there's more accountability of the nurses? Is this a better way to decrease the errors happening? Ask the families, do they like being involved in the patient's care in the morning, meeting the new nurses, meeting the new oncoming staff, and making sure that patients are also happy with being involved, being able to ask questions in the beginning, so their questions aren't left to the end of the shift. Also, monitoring HCAPs, are they increasing, are they decreasing? Medication errors the same, are they increasing, are they decreasing? And then also having the nurses take surveys to see it's, you know, benefiting the unit as a whole. Here's from another article. It says the literature suggested that implementing bedside reporting improves patient safety outcomes, strengthens nurse and patient family satisfaction, and increases accuracy and efficacy of report. That is all. Here are my references. Thank you so much.